The views, opinions, and statements expressed by our guests are solely their own and do not necessarily reflect those of Dr. Jason Littleton or the Concierge Doc podcast. We do not endorse or take responsibility for any statements, claims, or perspectives shared in this content. Viewers are encouraged to conduct their own research and form their own conclusions.
Access to the information and materials contained in this podcast is at your own risk. The information contained is presented for the purpose of educating the consumer on a variety of wellness and healthcare topics. The information. Nothing contained is intended to be instructional for medical diagnosis or treatment. The information contained is compiled from a variety of sources. The information should not be considered complete and exhaustive and should not be in place of a visit or consultation with your own primary care doctor. Welcome to the Concierge Doc podcast. I'm your host, CEO, and founder of Littleton Concierge Medicine, Dr. Jason Littleton. Welcome to the podcast. Today's guest is a plastic surgeon who did her residency with some of the nation's best surgeons at Advent Health in Orlando, Florida, then completed her plastic surgery fellowship in Summa Health in Akron, Ohio. She's a double board certified plastic surgeon who offers highly specialized and elevated concierge compassionate care. Please welcome to the Concierge Doc podcast, Dr. Stephenie Poris.
Thank you so much for having me, Dr. Littleton. It's an honor to be on your podcast, and I am so excited to talk today.
Awesome. Thank you. Thank you for being on. I've wanted to talk to you for a while and pretty excited about everything that you do. And, just like off the camera, I've had a second to talk with you about how you started your practice and you came right out of residency, and a lot of people don't do that. A lot of physicians don't do that. A lot of physicians are scared to do that. You've been wildly successful, and I wanted to start off talking a little bit about your bio, your background, and how you got started in business for yourself.
Yeah, I think for me, it all started with passion. I think ultimately, of course, there was the passion for plastic surgery and becoming a plastic surgeon, and that was, numero uno. But the second part of it was being able to control the experience and give my patients the quality health care that I thought, I could potentially deliver on a more sort of concierge, right? Level.
Right.
And I think, we do so much training. You're in training. For me, it was 8 years. I'm in a big institution. I trained in one of the largest institutions in the country.
Yeah.
And so I really got a very insider's view of big business, which is healthcare.
Right.
And for better or for worse, I think there are some positives to that in working in that type of environment, and certainly patients' experiences. But I do think there was a downside, and not to be negative, but I just thought that it wasn't for me. And if we go back to the primary statement, which was passion, it was how could I deliver the best care through me for my patients? And I don't think my care would have been as good in that kind of environment. And I said, I want to wake up doing what I love every day. And that's not only just the technique and art of plastic surgery, but that's the delivery of plastic surgery and patient care. And so ultimately, that's what I did. Some soul searching. I talked to many, many people in the field, people in private practice, people in small groups, and ultimately decided that this was the route that I wanted to go. And the how, the what, the who, the money, all of that, I said, well, listen, if, the nail salon down the street can open, why can't I, right? Of course I can do this. I've done, I feel like in my life, harder things. So basically that's where it came from.
That's exceptional and scary at the same time. And you've been so successful. It's such a success story. And, when anyone goes to your website, it's a very powerful website. It's very bright. It's very artistic. The message and the really just the branding is just awesome. And I think when people come to you, like, what do you tell them about their health? What do you tell them about their wellness when they come to you about certain, issues as it relates to plastic surgery? Like, what type of messaging are you communicating to your patients, to your clients? Obviously they're coming for many different reasons, maybe cosmetic, maybe more things to do with maybe injury that they've had, but what type of messaging are you telling them about wellness and things?
I think that I am lucky because I think when you step foot in my office as a patient, you are taking your first step or second step or however many steps it took you to get there for yourself. And so, this isn't an emergency appendectomy we're doing. This is, let's just say, I've lost 100 pounds and I have all this excess skin. Now, what do I do with it? You're taking a step for yourself, for your own wellness, for your own confidence by just getting into my office, right? That's the first move. And so from a wellness standpoint, we see every type of patient. We see young, we see old, we see middle-aged moms, we see divorcees, we see widows. A lot of what we do not only is just confidence boosting surgeries and non-surgical treatments, but there is a lot of hand-holding. There is a lot of psychology behind our consultations. And so part of what I do is really try to get to know the patient on a very relatable level, kind of meet them where they are and share their journey with them. And I think for most of my patients and anybody that has been treated at our office, I think they all would say that the experience was really what helped get them through. It's not just you come in for surgery and you're sort of seen in post-op and then you're gone. We really do bring you in as family and treat you as such. I think it's very easy for especially the big healthcare corporations to say patients first, patients are family, da 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 da. I mean, these are all marketing taglines, but to really practice what you preach and stand behind it is very important to us. And I think that that's the ethos of our office.
What are the top surgeries that you do, and what are the maybe the top things that you see people coming to you for?
So I have vowed to not become so niche. I think I am one of the young generation of plastic surgeons that really wants to practice it all, right? Face, breast, body, plastic surgery. I even do some breast reconstruction. I would say just by virtue of being a younger practice and being a female, I think I get the most breast and body patients. I get a lot of young moms like myself. And I love it. And I think it's incredibly wonderful and very relatable. I think that sort of where my passion is everything. I mean, I love the face. My father was a dentist and practiced dentistry for over 35 years. And so I have that brain of the face. But ultimately, there isn't any one surgery that I love more than another. I love it all. And ultimately, it's the transformation and the journey and the amount of confidence that I see these patients go through, that to me is the exciting part. And so that's sort of where I stand. I think exactly, like I said, and you'll see this all over my Instagram and our website. I mean, I do a lot of breast in the town, a ton of breast revision surgery. Patients that have had implants for 30 years, or maybe they need a lift and an implant or weight loss. I really do a lot of breast and body work. And I love it. It's great. It's fun. It's challenging. Every patient is incredibly different. So,
I mean, I think what are one of the things that I've always wondered is when should someone seek out a plastic surgeon versus, I don't know, maybe a dermatologist, general surgeon. Obviously they do different things, but for the public, they may not understand that. So at what point should a person seek out a plastic surgeon?
I think it's a great question. I think that this is a very important. I think for non-surgical interventions, anything from skincare to your regular Botox fillers, things like that, I think seeking out a dermatologist is absolutely wonderful and fine. I think dermatologists and plastic surgeons equally alike in the non-surgical field. We all have that adequate training to safely intervene and help you out. And I think safety is the key word here. I think if a patient is looking for deeper interventions that are at all surgical base, and this includes liposuction, okay, you need to see a board certified plastic surgeon. Board certified plastic surgeon. There are a million people and surgeons posing, and non-surgeons, okay, posing as plastic surgeons or cosmetic surgeons. They are not board certified. They'll say they're board certified because there is a cosmetic surgery board. It is not an American Board of Medical Specialties certified program. So you really need to do your research as a patient if you want any plastic surgical intervention. First and foremost. Now, who's a candidate? That was your other question. I think if your weight is stable, typically most of us plastic surgeons like patients' weight with a BMI less than 30. That is from a safety standpoint going to the operating room. We want you to be a non-smoker. We want you to have all your medical problems in check, right? High blood pressure needs to be controlled. Diabetes, A1C less than 6. You know, we want all of the T's crossed, I's dotted, because this is elective surgery. We don't want to put anybody under the needle or the knife that is going to have a complication due to their medical disease. So we are very, very particular. And so I think if you're all ready and you've checked all those boxes, then it's really time to see a plastic surgeon if you want said breast augmentation or mommy makeover. But definitely have your ducks in a row. Look for that board approved plastic surgeon, and just really know the ethics of the person you're seeing, right? What mode? Ask your question as a patient. I think I tell my patients this no matter who they're seeing, right? Know the ethics behind the physician and the staff and the office that you're talking to. Do you question their ethics? Do you think they're coming from a place that is safe, that is professional, that is going to do right by you in an emergency situation? And I think if you can answer yes to all those things, then it's probably the right surgeon for you.
No, that's
physician.
No, that's really good, because I think a lot of people make that mistake and then they end up in the ER, or you probably end up seeing them for redos. I mean, do you do a lot of redos where you see people who've had a botched surgery? Is that commonplace?
Absolutely.
Okay.
We get calls probably once or twice a week for patients that have been botched, you know, or quote unquote botched, right? We don't necessarily see them all. Who've traveled outside the country, who've gone to Miami. Now, Miami has some wonderful plastic surgeons, many of whom are very dear friends of mine, who are board certified, specialty trained, very, very good. But there's also a lot of what we call chop shops. And a lot of the patients get blinded by the discount, right? Oh, I can go to Miami and I can get a tummy tuck for $3,000. But they don't realize that the person doing their tummy tuck is not a surgeon. And they end up with these horrible outcomes. And, you know, I do medical review for the state of Florida, and you would be incredibly surprised at just the amount of misinformation and disinformation out there that these patients receive, and how devious a lot of these
I think that's so scary. I think that's so scary because with like social media these days, you know, some of these doctors can be just marketed like, you know, wow, that's the doctor I need to see. And when you think about plastic surgery, you think LA, you think Miami. So
it's marketing. Yeah. A lot of these, you know, plastic surgery clinics have great marketing. They've got a person that's, you know, part of a private equity firm or whomever that is doing incredible marketing for them, or they've picked a term that they've chosen to, you know, trend. And so patients think that 40,000 followers, 40 million followers on Instagram equals a good cosmetic outcome. And that's just not the case at all. And we, you know, those of us obviously in the field know that. But to a patient, social media and TikTok followers does not a good plastic surgeon make, or a good physician. I mean, that's why on my social, I don't care. Half of those people are bots anyways on Instagram. You know, when you see these patients, these surgeons and physicians with these big account numbers, I mean, it's not reality. You have to be real. This is your life.
So like what are some of the questions that a patient should have when they come and see you for the first time, so that they just, they're ready to go?
Yeah, I love it when patients bring a list of questions. I mean, and I think I've said this on other podcasts too. It means you're ready to listen. It means you're ready and you're focused and you've done your research. And you know this, Dr. Littleton, when a patient comes in well-researched, they're ready to take charge of their life. And ultimately for me, that's a change of confidence levels for them, right? So, we always start with the discussion. What are your goals? What do you want? What I want to hear from them, and we'll write it in quotes. I want, to feel good in my jeans. I don't want to have the muffin top, or, maybe their neck is a little saggy and they're on TV, right? I mean, I get a lot of people in media, and they, are sitting here on Instagram and Zoom, and they're like, oh, my neck just is starting to hang. And, what can we do about that, doc? And so the questions really are, well, what do you want? Okay. Again, are you healthy to undergo an operation? And what's your downtime look like, right? Because if you have zero downtime, well, then a surgery might not be for you, but there might be a non-surgical intervention that can help, right? So these are all things we'll kind of suss out during the consultation. And ultimately, we just take the time to answer any and all questions, and then, of course, give the patients the opportunity to ask more questions, and up until the day of their surgery or their treatment. So,
whenever I step into your office, because I've been in your office, it's, I feel healthy, and I am healthy, but I'm just saying it's so bright, it's so vibrant, everything like that. And so I think it obviously it's a reflection of you and wellness and how you want to treat the patient. Everyone knows I have this acronym: move, eat, drink, sleep, my meds protocol. And I talk to people about how to have healthy living and wellness through good movement, eating, hydration, and good rest. When I think about this, what are some of the things that you practice yourself in regards to just, moving, eating, drinking, sleep, that really sets your health apart and allows you to do what you do? Because you're busy, you're doing surgery, you're seeing patients, you're nonstop, you're on TV, you're on Instagram, all these things. How do you stay in tip-top shape, and what's the message that you communicate to your patients even about that?
Yeah, absolutely. So I will say, first and foremost, I definitely am still working on this. And it probably wasn't until the last 4 years that I really started to drill down on my own health. Again, for 8 years, when you're in training, in the thick of it, you're in boot camp, and you don't necessarily have the luxury of, getting lunch and even using the restroom if you need to. So it wasn't really until
I always tell people, eat when you can, pee when you can, sleep when you can.
Exactly. That is the mantra. And it's so sad that is the mantra, frankly, because I do think that we as medical personnel really need to practice what we preach.
Right.
So to be having to kind of step it back. But I can tell you, working out, I never stop moving, right? If we're talking about move, right. I don't stop moving. And somebody once said, and actually it was an older patient of mine, she was in her 80s, and she said, Dr. Poris, objects in motion, they continue in motion. And I love that saying. And I think when I slow down, when I'm not doing something, when I'm not moving, when I'm not active, that's when I feel the stress and the fatigue of life and, all of the things compounding. So I just try to keep moving. I try to keep busy, whether it's fitness, whether it's outside with my kids, whether it's just participating in active sports with my kids. Sometimes it's all I can do, right? I have like an hour a day where I have, some time. Sleep has become absolutely imperative. I think I misjudged for so long. I was on if I was lucky to get 2 hours or 4 hours a night, that was good. And now I'm literally catching up from 10 years of no sleep. And so I really, really try to get 6 to 8 hours a night. I think it's really, really important. Your skin, from a plastic surgeon standpoint, looks much better in the morning. You're less puffy, you're, less swollen eyes, you're more awake looking. Your body has time to rejuvenate. Your cells have time to take a minute and do all the things they need to do to be restorative. So that was absolutely something I did. And then let's talk about hydrate. I think for me, this is a very scary, maybe relatable story. So, I really wasn't much of a water lover, water drinker for the better part of my life. I would say up until pregnancies, I lived on Mountain Dew and, anything I could get my hands on in the hospital. Oh, it was terrible, terrible, terrible. And pregnancy, I took it very seriously. I didn't drink any caffeine, and I was really, really, serious about it. I wanted to give my kids the best chance in the environment that I was in. And, after I was pregnant, I didn't crave it anymore. I didn't want it. In fact, it almost, soda almost was a turnoff for me, which was lucky. I turned to LaCroix and all that stuff. But about 3 years ago, and I'll get a little personal, I had a little bit of a health scare. And ultimately, it turned out that I just was dehydrated.
Wow.
Like on a regular, consistent basis. You can't drink a LaCroix a day and think you are getting enough fluid.
Right.
That is literally where I was. Maybe not even a LaCroix a day.
Wow.
It's terrible. And
was it just because you were so busy, or what?
Yeah, it was because I was busy, but also because I wasn't taking charge of my own life,
Okay.
and I was, just thinking that I'm invincible and my body will never break down, and I'm young, so I can withstand the torture that I was putting my body through. And I had to make a major shift. And you know what this sounds silly. I don't like drinking out of aluminum, so you'll never find me with a Stanley. That's just gross to me. It's something about the aluminum. And sorry for the, people that are respecting the earth that are listening, but I get those big, giant Smart Waters at Costco.
Yep.
The big pallets of them. And I have one in every single room that I ever visit in my daily journey. I've got one in my bathroom. I've got one near my bed. I've got 2 on my desk. I have, some in the break room. I am constantly chugging that water. And for whatever reason, that water goes down for me very easily. I like the way it tastes. And so I have now found a way to stay hydrated and take care of my body. I will tell you, I get almost 0 headaches. I used to get massive migraines because I was so dehydrated.
Wow.
The health scare that I thought, I was going to die has gone, right? All of these things that just take it back to H2O. We need it in life. And so I think not to be undervalued. And for me, it was severely undervalued. And so when you say move, sleep, hydrate, let me tell you, I am a huge proponent of drinking that water now.
No, that's huge. It sounds like you've made, major changes in your hydration to fix that. 75% of Americans are chronically dehydrated and don't know it. And I mention that a lot, whether it's on this podcast or when I'm talking to people. And that's, I think everything you just shared, that's major. And thank you even for sharing that personal testimony. When I think about activities that people do, obviously, as doctors, we're busy, and staying healthy helps us to, stay in tip-top shape and do our businesses and see patients and everything like that. But do you have a hobby or anything like that you like doing? For me, I love skiing, and that motivates me to work out. It motivates me to move, eat, drink, sleep, all those things. Is there anything that Stephenie Poris, what is it? Walking, paddleboarding, skiing, anything?
Well, I think, Dr. Littleton, you and I are very similar. So skiing has always been the top of the top. Obviously, we live in Florida, so we're a little crippled by it.
You could water ski.
Right, we can water ski. Absolutely, I did, and I grew up water skiing actually. But and I was a figure skater for a long time. So I like the sports, the cold sports, which is kind of funny.
Mm-hmm.
I'm a true Floridian who really, really likes the cold sports. But yeah, so obviously when we can't snow ski, for me, my hobbies are kind of my alone time hobbies, right? I love just going on a walk and I love my husband. This has nothing to do with not wanting to be with my family, but for, so much of my life is interactions with others, my kids, my husband, my patients, my family. Sometimes I feel like just taking the time for me is now sort of become my hobby, right? And whether that's going and getting a massage or getting my hair cut has turned into a hobby, right? Like that's where I'm at in life. That's how busy things have gotten.
Okay.
Playing tennis with my friends, anything where I feel like, I can just sort of step back for a minute and take a deep breath and be a little introspective. I mean, I truly love my alone time. And I know this sounds crazy, but I mean, I think that retail therapy is excellent. I love just being in a store by myself, perusing a rack of, wasteless items that I don't need.
Retail therapy. I like that.
Retail therapy. There's some truth to this, right? And, it doesn't mean that you buy the store, but just that act of, sort of taking a moment and taking a breath. For me, that's my hobby. I mean, I used to be a painter and all of these things and have but the reality is, I think at different points in your life, you're going to have different hobbies. You're going to be at a different point. And so the point that I'm in is I'm going to take the little that I have and I'm going to turn it into something that is healthy for myself.
That's major. Actually, I'm glad you shared that. I mean, I think that's major. I think everyone needs to take that nugget and do something with it, because I think that is what is missing in a lot of people's lives as far as, reducing stress, dealing with feelings of being overwhelmed. I mean, what you just said, I thought is so major, actually. And I hope everyone hears that, because I think that's really an aha moment. And as you said, I'm like, yep, that's really good. That's really good. I think sometimes people get so busy that they don't do self-care. They don't do that retail therapy, the equivalent of what that is for them. So I thought that was major. So thank you for sharing that. I mean, look, talking to you is a fresh breath of air. I think you've shared so many things that, really could be inspiring for people. And I think your practice is inspiring. I think everybody should go see your office. They should go see how it's decorated and everything like that. They should, really look into if they need to have a consultation with you. What are the handles? How can people find you?
Yeah, absolutely. So our primary practice page on Instagram is at stiletto_surgeon. Okay. And then you can go to our website, porisplasticsurgery.com, call our office, 407-558-1616. There are a million ways to get in touch. We are probably one of the easiest communicative plastic surgery practices, so any way you find us, usually we'll respond. So, but those are our primary spots.
Well, thank you. Look, thank you for coming on the show. I really thank you for the things that you shared. And if you need plastic surgery, you got to go see Dr. Stephenie Poris. You got to go see her. See her office. Go sit down. Go talk to the people.
Thanks, Dr. Littleton. It's been so wonderful being with you today, and I'm just so appreciative.
Thank you so much. Well, everyone, again, continue to follow the podcast. Go to Facebook, Instagram, download this episode of the podcast. Thank you for listening, and thank you for another episode of the Concierge Doc Podcast.